For millions of people managing weight or metabolic health, access to medication is no longer defined only by whether a drug exists. It is shaped by how quickly it can be obtained, how far someone has to travel, and how much friction stands between a prescription and the start of treatment. What is changing here is not the science of these drugs, but the way they reach patients, and that is beginning to alter who can realistically access them and how consistently they can stay on them. In April 2026, a new access model began to form around a GLP-1 called Foundayo. Instead of relying only on traditional pharmacies or multi-day mail delivery, the drug became available through same-day delivery and in-clinic kiosks. For patients, that means the gap between receiving a prescription and receiving the medication can shrink from several days to potentially the same day. That goal was described directly by Amazon Pharmacy leadership and Eli Lilly. Tanvi Patel, a vice president at Amazon Pharmacy, emphasized broader access through kiosk storage, while Eli Lilly's Laura Steele said that patients could receive their medication same day or walk out with it in hand. Those statements point to a clear operational shift, reducing the delay between diagnosis and treatment. The change centers on distribution rather than formulation. Foundayo, an oral GLP-1 pill approved in 2026, does not require refrigeration. That changes how it can be stored, handled, and delivered. Unlike injectable GLP-1 drugs, which depend on cold chain logistics, this pill can be stocked in clinic-based kiosks and move through standard delivery networks without temperature constraints. That difference has practical consequences. Removing refrigeration requirements makes it possible to store medication closer to the patient. Storing it closer to the patient reduces delivery time. Shorter delivery times lower the chance that a prescription is delayed or never filled. For someone waiting to begin treatment, that means faster access with fewer logistical obstacles. The same pattern applies to geography. Amazon's same-day delivery network now reaches roughly half of U.S. customers and is expanding across about 3,000 cities and towns, with plans to reach about 4,500 locations by the end of 2026. In practical terms, this is aimed at areas where patients may live 45 to 60 minutes from a pharmacy. When access depends on long travel distances, delays are not just inconvenient. They can interrupt treatment altogether. Same-day delivery reduces that barrier by replacing a long trip with home delivery. Speed also changes the terms of access. Traditional mail-order pharmacy timelines range from 5 to 10 days. By contrast, same-day or 1 to 3 day delivery shortens that window significantly. The effect is straightforward. Shorter wait times reduce the period in which patients may go without medication. For people relying on consistent dosing, that consistency matters. Pricing adds another layer. Foundayo is listed at about $149 per month for cash-paying patients at lower doses, with prices as low as $25 per month for those with insurance. Medicare Part D pricing is expected to reach about $50 per month starting in July of 2026. Amazon describes that as roughly $5 per day for cash pay and about $1 per day with insurance. Those prices matter because they interact directly with access. Lower out-of-pocket costs combined with faster delivery reduce two of the most common barriers at the same time: affordability and availability. When both are reduced together, more patients are in a position to begin treatment and to remain on it without interruption. The structure of access is also changing. Amazon's model connects several steps: clinical care, prescribing, fulfillment, and delivery within one system. Through its One Medical clinics, patients can receive a prescription and obtain the medication immediately through an on-site kiosk. The membership model for One Medical is priced at $199 per year or $99 for Prime members, although membership is not required to access prescriptions. This creates a different healthcare pathway. Instead of moving between separate providers, pharmacies, and delivery systems, patients can complete the process within a single network. That is not simply a matter of convenience. It reduces the number of points where delays can occur. Fewer steps means fewer opportunities for missed prescriptions, processing delays, or logistical breakdowns. That shift builds on a longer timeline. Amazon entered the pharmacy market in 2018 through its acquisition of PillPack. By 2021, it was already delivering GLP-1 medications. In 2023, it acquired One Medical, bringing clinical services into the same system. In 2025, it began testing prescription kiosks inside clinics. By April 2026, those pieces had converged with the launch of Foundayo through both kiosk and same-day delivery. Each step in that sequence reflects a gradual consolidation of access points. Pharmacy services, clinical care, and distribution infrastructure are no longer operating as separate systems. They are being brought together into a single pipeline. That integration affects how patients experience the system. In a traditional model, when medication is delayed, the cause may be unclear, whether it's the pharmacy, the insurer, or the delivery process. In a more consolidated model, fewer variables are involved. That can reduce delays, but it also concentrates more control over access within a smaller number of companies. The physical expansion of delivery infrastructure is part of that shift. Amazon invested $4 billion in 2025 to expand its delivery network, with the goal of tripling capacity and reaching underserved areas. The impact of that investment is concrete. It helps determine whether a patient in a rural location receives medication within hours or waits several days. The clinic-based kiosks add another dimension. As of April 2026, 5 kiosks were operating in California, with broader rollout planned pending state regulations. The model is simple. After a doctor's visit, the patient does not need to travel to a pharmacy or wait for delivery. The medication is available immediately. The immediacy addresses a specific gap in access. In many cases, the delay between prescription and fulfillment creates uncertainty. Patients may postpone treatment, or logistical issues may prevent them from following through. Immediate access removes that gap. Taken together, these changes show a broader pattern. Access is being reshaped not by a new clinical breakthrough, but by the way medication moves through the system. Faster delivery, local storage, and integrated care pathways reduce friction at each stage. Less friction increases the likelihood that patients receive their medications and continue taking it. At this stage, the system is still expanding. Same-day delivery reaches roughly half the United States. Kiosk deployment remains limited but is growing. Pricing varies by insurance status, but lower-cost options now exist alongside cash pay alternatives. Infrastructure expansion is still underway, with broader reach planned through the end of 2026. What remains consistent is the central issue: access. The question is not only whether the medication exists, but whether it can be obtained quickly, affordably, and reliably. The current model is moving toward faster and more direct access, but its reach is still uneven. For patients, that difference is immediate. The gap between a week and receiving medication in the same day is more a matter of convenience. It affects whether treatment begins on time, whether it's interrupted, and how manageable it becomes over the long term. If you want more coverage like this, subscribe to Dose and Demand. And if you have a view on where this is heading, leave a comment. Does faster delivery and clinic pickup make GLP-1 access meaningfully better for patients? Or does it just shift control from pharmacies to a different gatekeeper?